Welcome to Solutions Ahead right here on India Ahead. Well, we're discussing about prostate cancer today, and joining me in the show today, Dr. Amit Jotwani, Dr. Vikas Agarwal and Dr. Saurabh Gaur. Well, if you want to call us with your queries, then you can call us, and the numbers to call on is 040-6013-1312. You can also write to us, and the email ID is solutions@indiaaheadnews.com. Well, my question here to Dr. Vikas now is that what are the treatment options of prostate cancer? If you can please tell our viewers about it.
The treatment of the prostate cancer, first of all, I would like to say our audience, there is nothing to be panic. There are so many things that we can offer to a patient who has been diagnosed with cancer prostate.
Right.
First of all, the family should be sportive, because once we heard the name cancer, we become panic. So the family support and the patient understanding and the counseling of the patient is very important, because this prostate cancer is an old age disease. So the family support is most important. Once you diagnose the prostate cancer and confirm it with the biopsy, we have to stage the prostate cancer like other cancer. It means that at what stage the prostate cancer is it. So if we say it is a stage 1, means it is localized to the prostate gland only. So there are the two options. Either we should go for surgery or we should go for radiotherapy. The pro and cons of surgery and radiotherapy we discuss with the patient, and if the patient is opt for any of these, so he can be cured in the stage 1 disease. If the prostate gland is not restricted for prostate cancer, or the cancer has gone the prostate gland, so it means that it is an advanced prostate cancer. But still there are so many things, and we can still give the patient the good quality of life and the good life expectancy. In this case, if the prostate cancer has gone beyond the prostate gland, so the options are localized treatment for the prostate gland or the systemic treatment. The systemic treatment we include is the hormonal therapy, in which we can remove the testis, or there are the injections available nowadays which can be given as a depot of 3 months or 6 months, which can be taken easily on the OPD basis, and patient can follow up with simple serum PSA test and can be managed easily. And there is no change in the quality of life and the function whatever he is doing, and there is no deformity.
Right.
And if we talk about the surgery is also in nowadays are done through a minimal invasive way, that is the laparoscopic or the robotic method. So in which patient can, from the next day of the surgery, he can be out of the bed, and after 3 to 4 days he can be discharged and managed. So it is very important that his family should understand the problem, and of course the patient. And I would like to add and to emphasize on this, that there is nothing to be panic if anybody is diagnosed with cancer prostate, because nowadays the longevity of the patient has increased. So more of this has to be diagnosed.
Right. Thank you so much for all that information. Well, Dr. Saurabh, my question to you is, since we're discussing treatment causes, how about talking about lifestyle modifications that people can make so that they can avoid a cancer like this, prostate cancer, to prevent it, I would say rather.
Definitely, lifestyle modification forms the major part of the treatment.
Yes.
As overall well-being of the patient, and also as he is suffering from cancer, it boosts up, it treats depression also.
Yes. So you would have somebody to counsel them as well?
Yeah, you can always go for a professional clinical counselor or clinical psychologist for counseling.
Because then anyway we're looking at an age group of 60 plus, where you already are feeling that something is not right, and maybe sometimes you lose the will to live also.
Ma'am, most important again, as Dr. Vikas rightly pointed out, most important is family support, and patient has to understand that this is a slow growing tumor and it is curable. Usually tumor outlives patient. If he is dying, he will die of other causes, 65, 80, 85, he may die of other causes, but very few cases he will die of prostate cancer.
Yes, that's
so
right.
this thing he has to make it clear.
Yeah.
Do not panic. Lifestyle modifications, regular exercises, healthy nutrition, good food, high protein, high vitamin intake, and all these things if he'll inculcate in his daily
Regular
activities,
routine,
regular
yes.
routine,
Yes.
then definitely the life expectancy and all will increase.
Right. So, Dr. Amit, my question to you here is, how can patients ensure that they get best treatment for cancer at onco.com? If you can throw some light on that, please.
See, cancer is a very complex condition. It requires complex treatments also. Nowadays, the science has advanced a lot, and there are treatments like chemotherapy, surgery, radiation. Within these treatments, chemotherapy, then there is immunotherapy. Radiation techniques have changed. We have much better directed techniques like radiosurgery, SBRT. Different complex treatments have arrived. So, one doctor cannot guide a patient on every possible treatment. Now, there are specialists for different treatments. There are medical oncologists, surgical oncologists, radiation oncologists. It's a multidisciplinary treatment approach for most of the cancers. The best way for any cancer patient is to seek multidisciplinary opinion. That way you get expertise from at least 2 to 3 doctors, oncologists who are experts in their fields. Nowadays there are organ specific experts even in India. This concept was more earlier there in US, but now we have very good senior doctors who are experts in different types of organs. So there are urological cancer, there is a gastrointestinal cancer experts, then there are brain tumor experts, there are lung cancer experts, there are breast cancer experts. So you need to find out, like at onco.com we guide them with finding right doctors. When they share details with us, we have a panel of more than 1,000 doctors whom whose details we have as to their expertise. So we connect the patients with those doctors to really get guidance on finding right doctor for them. So a multidisciplinary approach is important. Getting the right doctor through a credible source like onco.com is very important, because it's in cancer, it's one chance is the best chance. So it's always better to plan the treatment well, and a multidisciplinary approach is always helpful. In Western countries, that is for every patient goes through multidisciplinary approach, and we need to add this practice into for Indian patients.
Okay, we have a caller at this point, and let's find out what is their question. Welcome to Solutions Ahead.
Yeah, hi, my name is Kamal.
Hi.
I just want to know what test does a person have to go through if they see some symptoms of this kind of cancer?
Okay, so if they have symptoms like we're discussing right now, what is the first thing that they should do is what they want to know.
If he has the symptoms, so he should go to a qualified specialist and get examined. That is a distal rectal examination that is done in the OPD basis, and the other simple test is the serum PSA. After, if these two things are showing some detection or the abnormality, then one should go for MRI, that is a magnetic resonance imaging, and after that, to confirm the tissue, we have to get a biopsy done. So that is the whole process, and it is all an OPD procedure and can be done under daycare procedure, and after this all 3 tests we confirm that whether the patient is suffering from prostate cancer or not.
Okay.
So I would like to add,
Yes, please.
it's not necessary that you wait for symptoms. See, as there a screening program goes, and we personally want to diagnose it in early stage so that we can treat patients in a better way.
Right.
So it's important that after 40-45 years, you at least once go to a urologist and get a checkup done. And if you have any family history, like your brother or your father or your grandfather had suffered from prostate cancer, then definitely that is a high risk, and every 2 years, 2 to 3 years or yearly, you have to get a PSA and digital rectal examination done by a trained urologist.
Right. We have a caller here on Solutions Ahead. Hello and welcome to the show.
My name is Akansha, and I want to ask, why do celebrities have to travel to Western countries for cancer treatment? Don't we have enough facilities or better facilities in India?
Well, I think Dr. Amit can answer that question for us. Dr. Amit.
So in Western countries, why do celebrities? It's a common question that patients also ask us, and I don't think there is a problem of expertise. We have very good oncologists in the country, all are experts. Most of the infrastructure is also available to treat patients. Even you go to US or any Western country, the technology, the drugs, everything is available in India. The only difference being is that in US, the oncologists, especially in institutes who are practicing, they deal only with organs throughout their careers. Someone who is a lung cancer expert is an expert in lung cancer throughout their career. And those who are in breast cancer or GI cancers or brain tumor experts, they are experts in their own condition, in their own way, and throughout their career they practice. So in a way they appear to be better, and secondly they are doing a lot of clinical trials. So new treatments are coming up earlier in countries like US. That is the reason why maybe rich people who can afford, they try to go there and take treatment. For celebrities, it's also an issue of privacy, because there is always media attention. So maybe my reading is that it's not the expertise, but the main reason is the privacy that makes them go to countries like US, so that they can focus on their treatment and away from the media attention that they might get, and the people want to know about them, which many people don't like the privacy to be breached. So that looks like a main reason. Otherwise, Indian doctors and Indian hospitals are very well equipped now to treat all patients in the country.
Well, that's a lot of information here on prostate cancer, and I hope we've answered all your questions here. Thank you so much for taking time out, and thank you so much for being part of Solutions Ahead. You can write to us, you can ask us your questions for anything that is regarding a particular disease or a disorder, or maybe something to do with a particular industry. Any question that you have, you can send it across to us, and we will come up with the entire concept here on Solutions Ahead with our great panelists. Thank you for watching India Ahead. Thank you for watching Solutions Ahead.